First step, insertion of the iLTS-D. The mouth is opened with 2 hands, and a jaw thrust is performed, in order to elevate the epiglottis from the posterior pharyngeal wall. The jaw thrust elevates the epiglottis. The device is held like a pen. It is inserted in a midline approach, and rotated around the base of the tongue. The tooth mark indicates the depth of insertion. The device is inserted parallel to the hard palate, and then it is rotated around the base of the tongue. The jaw thrust shall maintain the epiglottis elevated from the posterior pharyngeal wall. The cuffs are inflated according to the recommended volume. The cuff pressure is controlled with a manometer. The pressure should not exceed 60 cm H2O. The iLTS-D is connected to a ventilation system. A gastric tube is inserted in the specific channel. The evacuation of stomach fluid and gas can be achieved. Second step, fiber optic intubation. The fiber scope is inserted up to the limit of the ventilation outlet of the iLTS-D. The ET tube is inserted along the fiber scope up to the proximal marker. In order to improve the view of the vocal cords, the iLTS-D can be slightly pulled outwards about 2 cm without deflating the cuffs, and then rotate right and left to identify the glottis. There are 2 techniques to insert the tracheal tube. Technique A, fiber scope is inserted up to the ventilation outlet. The ET tube is inserted into the trachea under fiber optic control. The cuff of the tracheal tube is inflated. The fiber scope is removed. The ET tube is connected to a respiration system, and the patient is ventilated. Technique B, fiber scope is inserted into the trachea. The fiber scope is inserted into the trachea, and the tracheal tube is railroaded along until it reaches its final position. The cuff of the ET tube is inflated. The fiber scope is removed. The tracheal tube is connected to a respiration system, and the patient is ventilated. Third step, removal of the iLTS-D. Deflate completely the cuffs of the intubating laryngeal tube. The connector of the tracheal tube is removed. The ET tube stabilizer is held with the non-dominant hand and positioned at the proximal tip of the tracheal tube. The dominant hand grabs the iLTS-D and pulls it out of the patient's mouth in a rotation around the base of the tongue. The ET tube is maintained with the stabilizer during the removal of the intubating laryngeal tube. When the tracheal tube is visible at the level of the ventilation area, then the stabilizer is removed. The ET tube is maintained and the iLTS-D is removed completely. The stabilizer should not push the tracheal tube into the trachea, but maintained it in position during the removal of the intubating laryngeal tube. The connector of the tracheal tube is inserted. The ET tube is connected to a respiration system, and the patient is ventilated. The cuff pressure of the tracheal tube is controlled.